Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy often find it difficult to stay awake for long periods of time, regardless of the circumstances. Narcolepsy can cause serious disruptions in your daily routine. Contrary to what some people believe, narcolepsy isn't related to depression, seizure disorders, fainting, simple lack of sleep, or other conditions that may cause abnormal sleep patterns. Narcolepsy is a chronic condition for which there's no cure. However, medications and lifestyle changes can help you manage the symptoms. Support from others, family, friends, employer, teachers, can help you cope with narcolepsy. The symptoms of narcolepsy most commonly begin between the ages of 10 and 25. They may worsen for the first few years, and then continue for life. They include excessive daytime sleepiness. People with narcolepsy fall asleep without warning, anywhere, anytime. For example, you may suddenly nod off while working or talking with friends. You may sleep for a few minutes or up to a half hour before awakening and feeling refreshed, but eventually you fall asleep again. You also may experience decreased alertness throughout the day. Excessive daytime sleepiness usually is the first symptom to appear and is often the most troublesome, making it difficult for you to concentrate and fully function. Sudden loss of muscle tone. This condition, called cataplexy, can cause a number of physical changes, from slurred speech to complete weakness of most muscles, and may last for a few seconds to a few minutes. Cataplexy is uncontrollable and is triggered by intense emotions, usually positive ones such as laughter or excitement, but sometimes fear, surprise, or anger. For example, your head may droop uncontrollably or your knees may suddenly buckle when you laugh. Some people with narcolepsy experience only 1 or 2 episodes of cataplexy a year, while others have numerous episodes daily. Not everyone with narcolepsy experiences cataplexy. Sleep paralysis. People with narcolepsy often experience a temporary inability to move or speak while falling asleep or upon waking. These episodes are usually brief, lasting 1 or 2 minutes, but can be frightening. You may be aware of the condition and have no difficulty recalling it afterward, even if you had no control over what was happening to you. This sleep paralysis mimics the type of temporary paralysis that normally occurs during rapid eye movement (REM) sleep, the period of sleep during which most dreaming occurs. This temporary immobility during REM sleep may prevent your body from acting out dream activity. Not everyone with sleep paralysis has narcolepsy, however. Many people without narcolepsy experience some episodes of sleep paralysis, especially in young adulthood. Hallucinations. These hallucinations are called hypnagogic hallucinations if occurring as you fall asleep and hypnopompic hallucinations if occurring upon waking. Because you may be semi-awake when you begin dreaming, you experience your dreams as reality, and they may be particularly vivid and frightening. Other characteristics: people with narcolepsy may have other sleep disorders, such as obstructive sleep apnea, a condition in which breathing starts and stops throughout the night, restless legs syndrome, and even insomnia. People with narcolepsy may also act out their dreams at night by flailing their arms or kicking and screaming. Some episodes of sleep attacks are brief, lasting seconds. Some people with narcolepsy experience automatic behavior during these brief episodes. For example, you may fall asleep while performing a task you normally perform, such as writing, typing, or driving, and you continue to function while asleep. When you awaken, you can't remember what you did, and you probably didn't do it well. Causes: the exact cause of narcolepsy isn't known. Genetics may play a role. Other factors, such as infection, may contribute to the development of narcolepsy. Normal sleep pattern versus narcolepsy. The normal process of falling asleep begins with a phase called non-rapid eye movement (NREM) sleep. During this phase, your brain waves slow considerably. After an hour or so of NREM sleep, your brain activity changes and REM sleep begins. Most dreaming occurs during REM sleep. In narcolepsy, however, you may suddenly enter into REM sleep without first experiencing NREM sleep, both at night and during the day. Some of the characteristics of REM sleep, such as sudden lack of muscle tone, sleep paralysis, and vivid dreams, occur during other sleep stages in people with narcolepsy. The role of brain chemicals: hypocretin is an important chemical in your brain that helps regulate wakefulness and REM sleep. People with narcolepsy have low levels of this neurochemical in their spinal fluid. It's particularly low in those who experience cataplexy. Exactly what causes the loss of hypocretin-producing cells in the brain isn't known, but experts suspect it's due to an autoimmune reaction. Lifestyle and home remedies. Lifestyle modifications are important in managing the symptoms of narcolepsy. You may benefit from these steps. Stick to a schedule. Go to sleep and wake up at the same time every day, including weekends. Take naps. Schedule short naps at regular intervals during the day. Naps of 20 minutes at strategic times during the day may be refreshing and reduce sleepiness for 1 to 3 hours. Some people may need longer naps. Avoid nicotine and alcohol. Using these substances, especially at night, can worsen your signs and symptoms. Get regular exercise. Moderate, regular exercise at least 4 to 5 hours before bedtime may help you feel more awake during the day and sleep better at night. Coping and support. Dealing with narcolepsy can be challenging. Making adjustments in your daily schedule may help. Consider these tips. Talk about it. Tell your employer or teachers about your condition and work with them to find ways to accommodate your needs. This may include taking naps during the day, breaking up monotonous tasks, recording meetings or classes, standing during meetings or lectures, and taking brisk walks at various times throughout the day. The Americans with Disabilities Act prohibits discrimination against workers with narcolepsy and requires employers to provide reasonable accommodation to qualified employees. Be safe. If you must drive a long distance, work with your doctor to establish a medication schedule that ensures the greatest likelihood of wakefulness during your drive. Stop for naps and exercise breaks whenever you feel drowsy. Don't drive if you feel your sleepiness is not well controlled. Support groups and counseling can help you and your loved ones cope with narcolepsy. Ask your doctor to help you locate a group or qualified counselor in your area.